This presentation is on Novant Health, which is based out of Winston-Salem, North Carolina. This presentation was compiled by Emily Stevens, Katrina Dang, Byron Brown, and Kelsey Bedolli. Novant Health was formed in 1997 as a not-for-profit organization. Since then, they have grown to over 800 locations. Their servicing departments include emergency, urgent care, behavioral health, cancer care, heart and vascular care, inpatient services, neurology and neurosurgery, orthopedics, pediatrics, primary care, rehabilitation, sports medicine, weight loss, and women's health. Their locations include hospitals, emergency care, urgent care, express care, imaging, and clinical care. They do also have multiple centers of excellence. This does include a minimally invasive gynecological center, Heart and Vascular Institute, Cancer Center, Women's Center, Stroke and Neurosciences Center, Behavioral Health, and Children's Emergency Room. The mission of Novant Health exists to improve the health of our communities one person at a time. Their organizational structure is defined as being hierarchical, but because they do highly value communication between all employees, there does exist a unique partnership between administrators and physicians. Their structure is also somewhat determined by their status as a private nonprofit system. Novant has locations within North Carolina, South Carolina, and Virginia. Their largest cities served are Winston-Salem, North Carolina, Charlotte, North Carolina, Manassas, Virginia, and Haymarket, Virginia. But because it is based out of Winston-Salem, we did focus on that community. Winston-Salem is located within Forsyth County of North Carolina. It is considered an urban county. As of 2019, only 7.4% of the population there lives in rural areas. The city of Winston-Salem itself is not considered to be disadvantaged, but many areas around it are considered to be moderately to highly disadvantaged. The stakeholders include patients, employees, and their vast network of community partners. Their city demographic breakdown within Winston-Salem, according to the most recent U.S. Census, includes 54.9% white, 34.2% Black or African American, 2.5% Asian, 0.3% Native American or Alaska Native, 0.1% Native Hawaiian or Pacific Islander, and of those races, 15.1% are Hispanic or Latino. Significant health issues within the Novant service area include stroke. This is part of the stroke belt, this part of the country. It is an 11-state region of the southeastern United States that does exhibit a 34% higher risk of stroke than the rest of the country. Obviously, because this is across 11 states, this is not unique to Winston-Salem or Virginia or even the Carolinas, but it does play a significant role in their innovation technology and how they serve their community. Specific to Forsyth County, though, average infant mortality rate and chlamydia cases have both been on the rise in recent years. For Forsyth County, the leading cause of mortality is chronic diseases and conditions, mostly looking at death rates due to cancer, heart disease, chronic lower respiratory diseases, and cerebrovascular diseases. These were all higher than their peer counties. Novant Health has several different medical centers within a 10-mile radius from Winston-Salem, North Carolina. They do accept Medicare, Medicaid, and several different private insurances. Novant has also created some of its own insurance partnerships with Blue Cross and Blue Shield. Competition for the Winston-Salem area includes Atrium Health Wake Forest Baptist. They do have many facilities within 3 miles of the city center of Winston-Salem, and Cone Health that has multiple facilities within 10 miles from the city center. Both of these competitors do have several different medical centers and specialties as well. Major innovations to improve care. As of 2019, they launched the Institute for Innovation in Artificial Intelligence. This is a large umbrella organization that includes multiple initiatives. And as of March of 2022, they have launched Novant Health Enterprises. This was basically launched 1 month before the start of class, and it is intended to dovetail with the Institute for Innovation in Artificial Intelligence. The focus of the Institute of Innovation and Artificial Intelligence is on advanced technologies that provide highly personalized care and mechanisms to provide preventative prediction, diagnosis, and treatment. They do partner with other healthcare organizations, research organizations, universities, and tech companies to fully utilize the tech and data that are already in place at Novant to provide perpetual growth. Employment at the Institute varies, as some people have full-time assignments. Others facilitate special projects and rotate in and out on an as-needed basis as subject matter experts. Leaders throughout all of Novant are encouraged to participate, specifically with their Innovation Lab. The Innovation Lab is located in Charlotte, but again, all employees are encouraged to participate. This lab includes 3D printers, product prototyping equipment, engineers, industrial designers, and FDA application assistants. As far as the artificial intelligence is concerned, this has multiple prongs of import for Novant Health. It is used for large-scale data analysis and patient charts to find trends for both preventative prediction and ways to bring down costs without adversely affecting outcomes. For example, they looked at variations in tests ordered by treating providers looking at pneumonia, uncomplicated pneumonia, to see who was essentially ordering excessive testing that did not affect outcome in any appreciable manner. The artificial intelligence then looks over all of these records and can help make providers make determinations on what testing is necessary and what testing is not. By reducing unnecessary testing, they do also reduce costs. Also, by ensuring data analysis in all of the communities that they serve, AI is considered to be a great equalizer for health equity, as it gets rid of any unintentional or implicit bias. The artificial intelligence is also used specifically for strokes, again going back to the fact that this is within the stroke belt of the United States. Stroke specialists within Novant all have the Viz.ai technology on their smartphones. One of the intentions here is to improve collaboration among all specialists and providers involved for stroke patients. This reduces communication time and so far has been saving an average of 10 minutes per stroke patient, which roughly equates to over 19 million brain cells saved in the event of a stroke. This specializes with large vessel occlusion strokes, also known as LVO strokes, and they are the first in the Carolinas to utilize such technology. Other prongs of the Institute include the Digital Health and Engagement Team. Its mission is to create a healthcare delivery platform that connects a person's entire healthcare journey and delivers a personalized experience. In an interview, Angela Yoakum, who is one of the leaders of the Institute, she is an executive vice president for Novant Health, as well as a chief transformation and digital officer. She explained how through multiple technological innovations from sensors within chairs to sensors within the equipment itself, the Cancer Center, specifically the infusion center within the Cancer Center, has been able to completely eliminate their wait room without compromising time that the patients spend there or any sort of decrease in accuracy of delivery of care. They are able to very promptly measure when people are coming in, how long they should be there, how far through their treatment they are, and even assign which chair they should go to. This is saving significant patient time as, again, the wait is completely eliminated. Also, as part of their not-for-profit status, they have launched Community Voice. This is a community of patients who give input to help Novant design healthcare experiences in line with patient preferences, so they are getting real-time feedback from their patients to know what directions all of the digital experience and technology should be going in for increased patient satisfaction. Part of this is that they have also now launched activated assistants, voice-activated assistants for Amazon Echo and Google Home. This allows patients to search for locations as well as searching by medical specialty within Novant Health. Again, the partner to this institute is the newly launched Novant Health Enterprises. This is envisioned as an incubator to accelerate development of solutions to unlock clinical, financial, and patient value. It's intended to better enable partnerships with other healthcare organizations, create diversified growth, and generate additional value. The hope here is to accelerate improvements that Novant is already making through very purposeful investments in clinical, operational, and technological advancements. This division is led by Dean Swindle. He is president of this new division. Angela Yoakum will be the Chief Operating Officer and General Manager. She and Eric Eskioglu lead the Innovation Institute, so as you can see, there is some direct partnership there. The operational framework for the Novant Health Enterprises entity is still being planned, as well as their strategic planning. They are hoping to have that developed within the next year. References for further reading can be found here, as well as on the Novant Health website in general.